As we age, maintaining heart health becomes increasingly important. While vegetables are generally heart healthy, some may need to be limited or avoided by seniors, especially if they have specific heart-related concerns like high blood pressure, kidney disease, or blood-thinning medication use. Cross-section of an artery narrowing due to high sodium intake. Molecular structure of sodium chloride beside a blood pressure gauge. Scientific diagram showing sodium's effect on water retention in blood vessels. Elderly heart under pressure from salt-heavy diet. Bar graph comparing sodium in fresh versus canned vegetables. Kidney diagram showing overload from excess sodium. Brain scan showing stroke risk linked to high sodium diet. Salt molecules entering bloodstream, causing hypertension in seniors. Electrolyte imbalance chart highlighting sodium's role. Label analysis, 1,000 milliliter sodium canned soup versus 50 milliliter fresh. Chemical pathway, sodium affecting renin-angiotensin-aldosterone system. Sodium-potassium pump mechanism overloaded due to high salt intake. Heart diagram showing increased ventricular wall stress from salt. Seniors' blood vessels becoming less elastic due to long-term sodium. Flowchart, sodium, high BP, heart failure. Hypertensive senior after consuming pickled vegetables. Microscopic view of endothelial dysfunction caused by salt. Heart, monitor spike after salty meal. Excess salt shown blocking nitric oxide release in arteries. Illustration, high salt vegetables causing arterial stiffness. Sodium-induced fluid retention visualized in aging body. Canned veggie comparison, regular versus no salt added effect on blood pressure. Sodium influx through gut into bloodstream, impacting. Elderly. Oxidative stress induced by sodium-rich diet in aging hearts. Elderly man with high blood pressure holding salt-laden canned vegetables. Vitamin K and blood thinners. Vitamin K metabolism pathway interfering with warfarin. Illustration of vitamin K blocking anticoagulant effect. Chart of INR, international normalized ratio. Fluctuations with varying greens intake. Diagram, kale. Vitamin K, reduced blood thinner effect. Elderly person eating broccoli while on warfarin, warning icon. Visual guide, stable vitamin K intake chart for medication users. Consistency scale, steady spinach intake. Safe INR, artery. With clot risk due to vitamin K imbalance. Infographic, vitamin K rich veggies versus low vitamin K veggies. Comparison, clotting time with VRUs without excess greens. Liver enzyme interaction with coumarin-based blood thinners. Cross-section of blood clot forming in leg vein, DVT. Warfarin structure beside leafy greens. Interaction symbol. Doctor, explaining vitamin K pathway to elderly patient. Blood viscosity change graph after inconsistent greens consumption. Microscope image of fibrin networks forming clots. Elder patient's medical report showing unstable INR due to kale diet. Educational card. Greens and warfarin. Balance is key. Interaction chart. Various veggies and blood thinners. Kinetic model of warfarin inhibition by vitamin K epoxide reductase. Warfarin pill versus spinach. Molecular tug of war. Tablet. And food diary being used together to manage greens intake. Vitamin K labeled as coagulation cofactor in simplified pathway. Cartoon, broccoli blocking effectiveness of a medication arrow. Artery cross-section with clot after excessive kale intake. Nightshades and inflammation in sensitive individuals. Inflammatory markers, CRP, IL-6, rising after nightshade consumption. Diagram, capsaicin or solanine pathway causing inflammation. Arthritis flare-up linked to nightshade glycoalkaloids. Solanine molecule from potatoes damaging gut lining in older adults. Digestive tract permeability increased by nightshade consumption. Autoimmune response illustration triggered by eggplant. Tomato glycoalkaloid entering bloodstream triggering macrophages. Illustration of elderly person with joint inflammation after nightshades. Lab test results showing inflammatory response after bell pepper intake. Microbiome imbalance caused by solanine in seniors. Diagram, cytokine storm triggered by nightshades in sensitive seniors. Visual, nightshades increasing. TNF-alpha levels in vulnerable populations. Gut-brain connection showing increased inflammation after tomato-heavy diet. Mouse study model showing joint inflammation from nightshades. Mitochondrial stress in cells exposed to glycoalkaloids. Bar chart, inflammatory response to various vegetable types. Visualization, solanine accumulating in tissues over time. DNA methylation changes from chronic inflammation. Flowchart, eggplant, glycoalkaloids, systemic inflammation. Medical professional explaining nightshade sensitivity to older patient. Graph showing pain level spikes after nightshade-rich meals. Nutrient absorption reduction from solanine-laden foods. Comparative cytokine test, nightshades versus anti-inflammatory veggies. Checklist, is nightshade inflammation affecting your heart? Body scan highlighting inflammation hotspots in nightshade-sensitive senior. Raw sprouts and foodborne illness, risk bacteria, E. coli salmonella, colonizing raw sprouts under microscope, senior immune system chart compared to younger adult. Gut infection after eating raw alfalfa sprouts in elderly. Petri dish showing bacterial growth from raw sprout sample. Timeline, sprout contamination from seed to plate. Food safety advisory highlighting risk in raw sprouts. Immune cell, macrophage, struggling to fight infection in seniors. Temperature danger zone, chart for sprout bacteria growth. Close-up of contaminated sprout roots. Flowchart, ingestion, infection, sepsis risk in elderly. CDC graphic warning seniors against raw sprouts. Comparison of cooked versus raw sprouts in bacterial risk. Sprouts labeled unsafe in senior-specific meal plan. Sprout recall notice with senior care warning. Visual, gut inflammation due to sprout-based pathogen. Timeline, onset of symptoms after infected sprout meal. Cartoon of pathogens sneaking into bloodstream via sprouts. Symptoms of foodborne illness in seniors, charted. Diagram of intestinal wall damage from bacteria. Immune suppression pathway in aging bodies versus infection. Checklist. Safe sprout handling for elderly. Bar graph. Hospitalization risk from sprouts by age group. Elderly woman cooking sprouts to kill bacteria. Sprout label. Must be. Cooked, high risk for vulnerable adults. Side by side, healthy gut versus infected gut post-sprout consumption.